We're here at MedTech World in Miami, Florida. I'm Logan Plaster, here with Barry Katzen, Dr. Barry Katzen, a very special guest here in the Media Lounge because last night or yesterday you were awarded a Lifetime Achievement Award. So first of all, just congratulations.
Thank you very much. It's a very big honor and a pleasure to be recognized by the organization.
Remind me what specialty you practice in?
So I'm an interventional radiologist by medical training, but for about the past 35 years, I've been leading a cardiovascular program here in South Florida as the chief medical executive and founder of Miami Cardiac and Vascular Institute. So in that role, I've been very involved in innovating less invasive types of procedures and bringing patients less invasive alternatives to open surgery. And the Institute's had a commitment to seeking less invasive alternatives for patients, whether it's a catheter replacing surgery or a pill replacing a catheter. It doesn't really matter, but we have that institutional commitment. So as a result, I've been very involved in the MedTech space in terms of using that technology to accomplish those goals.
What are you most proud of for when you look back over that work? Let's just say over the last decade.
Well, it's been an amazing journey because medicine's really changed over these past several decades. When you think back 30 or 40 years, if a patient had a lump in their abdomen or a lump in their chest or something that showed up on a chest x-ray, the only way to really find out what it was open surgery. Nowadays, the man on the street would say, isn't there a less invasive way to doing whatever the thing I need to have done is? So that change was actually incremental and occurred over these decades. And a lot of it had to do with developing sophisticated imaging to see inside the body, and a group of pioneers who, were seeking to change and improve healthcare by altering the status quo, basically. And so I think in terms of any personal accomplishments, one is the Institute itself, because we built a patient-centered care model, which was radical. So it's not technology, but changing the way we take care of patients.
I'm going to pause you just for a moment because you said patient-centered care model was part of the core innovation. That's one of those phrases that gets thrown around a lot. What did that mean for you?
So for me, that meant getting all the doctors of different specialists to work together to solve a specific patient's problem.
A collaborative team approach.
A collaborative team approach.
Wrapped around a patient.
Right, which sounds simple enough, but like many innovations, is very hard to execute on. And now that we've been existing for 30 years plus, almost 40, it's part of culture. And once you get those kind of changes embedded as part of culture, they can withstand a lot of other things, external forces and things like that. So it's interesting because patient-centered care is not as fancy as widgets or bricks and mortar, you see, but patients feel it. And they write comments about how we could feel that all the doctors were working together to try to solve my problem. We get written notes like that. So it brings a lot of satisfaction to actually see that working and operating on a day-by-day basis.
So given your decades of experience kind of really rolling out that sort of patient-centered care model, I'd be curious to know your thoughts on the current crop of medtech companies and maybe where there's opportunity for growth to become more patient-centric.
I think that the current medtech environment is super exciting because there's so much activity. And anything that drives collaborative care or assists collaborative care is going to be a winner. Lots of times, however, these technologies can be disruptive because they can...
And not in a cool way.
Right.
Everyone uses the word disruptive.
Turf or, we have this great new widget, a great new way of doing things, but who's going to do it? And when you have, so very frequently the technology is developed by a specialty that's not necessarily directly involved because, with the actual daily patient care and workflow. So that's one of the challenges. But I think in terms of your original question about the medtech environment, I think the focus on collaborative care, cost-effective care, and improving quality are things that really need to drive success for all these startup companies.
In your experience, in your clinic, are the applications of AI mostly hype, or are you seeing quick applications and usage now? in collaboration?
The talk is over. It's happening.
It's happening,
All right.
yeah.
And on a daily basis, and it's weaving its way in, sometimes quietly, sometimes in a more noisy way or more disruptive. And it's really part of everything we do. Within hospitals and healthcare systems, it represents both benefit and risk. And so one of the things we've been challenged with in our own organization is looking at AI governance. Because if AI is involved in the decision making, who owns the result?
Yeah.
All right. Whose decision actually was it? And so that's one of the challenges. But by and large, we see a lot of AI in imaging applications. We're looking at AI applications to make to interact with patients,
Yeah.
to make physicians' workflow better. And
I'm curious what the process is, the acquisition process in your clinical setting. Who is vetting the AI opportunities?
Right. So in a large healthcare system and in our organization, it can come in through any door.
Okay.
And we're organized in our health system by institutes. So within the Cardiovascular Institute, it would come in anywhere through there. If somebody has an idea, they either want to co-develop a product or co-create a product or use a product that already exists.
Yeah.
And that has to be vetted and ultimately goes through an AI governance process. And
Got
the FDA has actually issued regulations on what should happen as relates to AI development and
Okay.
governance even. So there are national guidelines
Okay, good.
about how that should happen.
Very nice, very nice. What's next for you? What are you working on this year?
Well, so I'm the Chief Innovation Officer for our health system, that's Baptist Health South Florida. And one of the reasons I'm so engaged in this conference, in fact, is interacting with people because we believe to advance MedTech innovations, it has to be in collaboration with the clinical side. And we're going to be actually doing a panel on this later today.
Okay.
But I'm very engaged in bringing models of co-creation into our health system. And these are across all areas of medicine, and neuroscience, and cancer, and cardiovascular work,
Yeah.
and so on.
I'm hearing a trend. You said collaborative, patient-centered care, and co-creation of the technology
Right.
itself. So this idea, I mean, is
Well,
this deeply embedded in your work?
Absolutely, and because I spent my career in innovation, and I spent a lot of time studying failure, which I think is really
Okay.
important if you want to be successful.
Yeah.
I think one of the big causes of failure is not having the right clinical input and having the clinical environment in which to test it.
Yeah.
And so you commit all these resources first and then find out way too late that it's not going to work. And
Yeah.
so I think that's the role of physicians, and it's the role of healthcare systems where we can help accelerate innovation by participating early on.
Are you finding physicians to be receptive? Physicians have historically been slow to adopt change.
So I think physicians are humans like everybody else. You have people that resist change, people who embrace change and advocate it, and they're the disruptors. And I think with our own medical staff, I have an appropriate mix. Of both.
A bell curve
Right.
of laggards and
Yeah,
leaders.
But I think the idea in terms of our innovation program is to support those people who want to advance new ideas.
Awesome. Dr. Katzen, great to meet you.
Pleasure.
Congrats on the award last
Thank you.
night. And I wish you all the best at your clinic as you push things forward.
Thank you very much. A pleasure.
Great to meet you.
Same here.